Edutainment Studios welcomes you to On Bended Knee, Knee Problems. This module is part 4 of a 7-part series on knee problems. Although a knee problem is often caused by an injury to one of the 3 bones, ligaments, tendons, cartilage, or to the bursae, it may have another cause. Some people are more likely to develop knee problems than others. Many jobs, sports, and recreation activities, getting older, or having a disease such as osteoporosis or arthritis increase your chances of having problems with your knees. In this course, the objective is to help you learn what are some common knee problems. Major types of arthritis can affect your knees. The major types of arthritis that can affect your knees are osteoarthritis, rheumatoid arthritis, and post-traumatic arthritis. Osteoarthritis is the common form of arthritis in the knee. It is a degenerative wear and tear type of arthritis that occurs most often in people 50 years of age and older, but may occur in younger people as well. With osteoarthritis, the cartilage in the knee joint gradually wears away. As this happens, it becomes frayed and rough, while the protective space between the bones decreases. This can result in bone rubbing on bone and produce painful bone spurs. Osteoarthritis develops slowly, and the pain it causes worsens over time. There are a few ways to treat this type, including over-the-counter and prescription medications, aspirin, acetaminophen, NSAIDs, etc. Exercise and weight loss will also improve movement and strengthen the joint. Rheumatoid arthritis is a chronic disease that attacks multiple joints throughout the body, including the knee joint. It is symmetrical, meaning that it usually affects the same joint on both sides of the body. In rheumatoid arthritis, the synovial membrane that covers the knee joint begins to swell. This usually results in knee pain and stiffness. Rheumatoid arthritis is an autoimmune disease, where the immune system attacks its own tissues and softens the bone. Treatment can include medication, physical therapy, and in worst-case scenarios, surgery may be needed to replace the knee. Post-traumatic arthritis is a form of arthritis that develops after an injury to the knee. For example, a broken bone may damage the joint surface and lead to arthritis years after the injury. Meniscal tears and ligament injuries can cause instability and additional wear on the knee joint, which over time can result in arthritis. Cartilage injuries can be another cause of knee problems. Chondromalacia occurs when the cartilage of the kneecap softens. This can be caused by injury, overuse, muscle weakness, or if parts of the knee are out of alignment. Chondromalacia can develop if a blow to the kneecap tears off a piece of cartilage or a piece of cartilage containing a bone fragment. The meniscus is a C-shaped piece of cartilage that acts like a pad between the femur or thigh bone and tibia or shin bone. It is easily injured if the knee is twisted while bearing weight. A partial or total tear may occur. If the tear is tiny, the meniscus stays connected to the front and back of the knee. If the tear is large, the meniscus may be left hanging by a thread of cartilage. The seriousness of the injury depends on the location and size of the tear. Treatment for cartilage injuries include exercises to strengthen the muscles, electrical stimulation to strengthen the muscles, and surgery for severe injuries. 2 commonly injured ligaments in the knee are the anterior cruciate ligament or ACL and the posterior cruciate ligament or PCL. An injury to these ligaments, sometimes called a sprain, the ACL is most often stretched or torn by a sudden twisting motion. The PCL is usually injured by a direct impact, such as an automobile accident or football tackle. The medial and lateral collateral ligaments are usually injured by a blow to the outer side of the knee, which can stretch and tear a ligament. These blows frequently occur in sports such as football or hockey. Ligament injuries are treated with ice packs immediately after the injury to reduce swelling, exercises to strengthen muscles, a brace or surgery for more severe injuries. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 4 of 7 on knee problems, and please join us for Part 5.